join, and we are going to be taping this for other Circle of Care members who could not join us. So we appreciate you being able to be on, and I'll turn it over to you, Doug.
Well, Doug Cropper, I think most people know me, but if you don't, Doug Cropper, President CEO of Genesis Health System, and what an interesting day we find ourselves in today, and we'll talk about that a little bit more. How do we deal with storms like this from a healthcare standpoint? But thank you very much for joining the call, and especially thank you for your financial support of Genesis and of those important projects that get funded through the foundation. This provides us a measure of excellence, and we really have a wonderful collection of mission-based programs and services. It's these funds and legacy gifts that bring us through challenging times like storms and pandemics. And I'll talk a little bit more about it, but philanthropy will be such a critical element of our future success, particularly related to things like telehealth, training for nurses, and other things like that. So let me just talk a little bit about what's going on. Let me first talk about maybe what's going on with the storm, since that's, you know, the latest thing that's happened in the last 24 hours. And I think that our golf outing for the foundation may be a little bit jinxed because we have had some bad weather, but nothing like yesterday. I was at the golf outing and got in 3 holes where our team was very hot, I hate to say, and we could not finish the 18. So we'll see if we're as hot when we have the golf outing time, you know, 2.0. But these are interesting things when we have storms like this. We have emergency generators at our hospitals, and they cover most of the areas, except for the what we would call non-essential areas like administrative suites on the West Campus where I am. But they cover most of our services, and certainly cover things like our nursing units and our cath labs and our ORs, and we can run for days and days and days. You know, we can run as long as they can bring us diesel fuel. We have generators, and we have backup generators to the backup generators, and so it's a situation where we really are in good shape in relationship to emergency power. We are actually rethinking today, given the type of power outage that this is, that we probably ought to put in generator power for our large healthplex facilities. It is our West Davenport Healthplex that is without power today, and some of our other offices like up in DeWitt, but the West Davenport Healthplex has, you know, 20 plus physicians in it, and that creates a lot of challenge for us to be able to provide healthcare when it doesn't have power. So I think we'll think about that a little bit differently. Interestingly enough, the biggest challenge for us today is our home care services, and that would include people that are also on home oxygen. So we have about 1,000 people we care for in home care, either people who are in our hospice home program at the end of life, or just our general home services, which may be follow-up from discharge. That's a lot of people to care for at home. And obviously that becomes tough when you have a situation like you do at my house with no power. Although we do have a generator, but our 80-year-old neighbors are right next door, and we were over there 3 times or 4 last night trying to help them without power. That's a difficult situation when you have a healthcare issue. And if you're on oxygen, you just had to transfer from your generator that produces oxygen within your home to oxygen tanks. And that means if you're on high flow oxygen, we have to get you tanks pretty frequently within the day. And that gets pretty complicated. So we have a lot of people that have mobilized to supply those 1,100 people, about 1/3 of which don't have power with oxygen. So that's kind of the latest that's going on with the storm. And I talked to the city of Bettendorf. I haven't talked to the city of Davenport, but I talked to the city of Bettendorf people, and they said it may be up to a week. So we'll see what actually occurs in relationship to restoring power everywhere. Let me talk a little bit about COVID-19, which is certainly the big story of 2020, and what a year it's going to go down and be. If you look at 2020 and COVID-19, we've done a number of things. Obviously, it was in March that everything started, and March was a hugely challenging month from an administrative standpoint, because we had to we had to put in all of our safety measures for COVID-19 at the same time that we brought our volume down to 100% of what it normally runs, down to 50%, and stopped any kind of elective procedures, canceled all of our electives. And then so many new things that we had to put in place, like safety measures, making sure that we had PPE. I don't think I've ever seen a time in my 39-year career like the month of March and the first part of April. We do have a number of safety measures that are in place. We have screening at our hospital facilities, limited visitor hours, which is good from a safety standpoint, bad from the standpoint of making sure that we do all the service elements that we'd like to be able to do for a family. We're in very good shape with personal protective equipment. I can talk about that more. We did some very unique things and innovative things there, like investing in the largest personal equipment manufacturer in the United States to help them do more domestic manufacturing. And then some of the positive things that happen with new construction. GMC Davenport has very unique features built into the facility that make it very safe from a filtering and purifying the air standpoint. We wish we had those at all of our facilities, like Silva's, for instance. And as we replace the air handlers, we'll do that. But as that air gets filtered, all the viruses get killed. And so it makes things very safe. So tremendous number of safety measures that have been put in place in our facilities. You may be interested in just kind of what happens on a daily basis at Genesis. And I'm just looking over some of our recent statistics. On any given day, we do anywhere from 200 to 300 COVID-19 tests. Some of those are pre-procedure tests. The laws in both, well, they're not laws, but they're new regulations in both Iowa and Illinois require us, if you're going to have surgery, to test you within 72 hours. And so we do that. We've only had 4 patients out of about 2,000 have tested positive with that. So all those pre-procedure tests, as well as anybody that's symptomatic, gets tested. So on any given day, it ranges from about 200 to 300. That's our piece. And Test Iowa also is something different. That's run by the state. That's another about 250. And then Unity Point would have a similar number. So every day about 600 people, 600 I would say to about 800 people get tested in the Quad Cities. We're running a positive rate for symptomatic patients. This is the key indicator. So there's kind of the precursor that gives you an idea of how many cases there are. The number of people that get sick is another indicator. Then moving downstream, the people that get hospitalized, and then the people that are most sick within the ICU. So one of the key indicators is what's the percentage of positives for people who are symptomatic. And anything under 5 is good. Between 5 and 10 is kind of a yellow light. Above 10 is a red light. And above 15 is a serious problem. In July, we ran at 18 on a few days. That was a very concerning. Right now, we're running at 5 or below. So we're in pretty good shape right now within the region in relationship to COVID-19. And I think that has to do with everything that we talk about, which is masking, social distancing. So the most part, we are doing very well there. And that's what's kind of holding incidence of the disease down. Any given day, though, we have 20 to 25 people within our hospitals that have COVID-19 and care for those. One of our greatest challenges, I can talk about this more, is the ICU. We are prepared to take care of literally hundreds of patients if we need to on our general medical units. But the ICU is a particular challenging area. There's only so many ICU beds, only so many ICU staff. And right now, today, I think there were 7 in the ICU. There were 8 yesterday. And these people have very long lengths of stay, in some cases 3 weeks length of stay. And so if you just put one person in the ICU, after 3 weeks, one person in the ICU per day, you're going to be full in the ICU. And so we're very concerned about having the sickest of the sick, increase and having our ICUs be overrun. If that happens, then what we'll do is we'll start to shut down OR services again. We'll take those OR nurses and those recovery room nurses, bring them to the ICU. overflow into other units and then take care of those patients. We have not yet had to do that, but when you hear us push the panic button to the community, like we were in early July, that's what we're afraid of. That's the big concern that we have. Let me talk a little bit about kind of pharmaceuticals and protocols. Remdesivir and its companion drugs are the most effective thing to fight COVID-19 right now and to take care of COVID-19 patients. There's obviously no cure. Everyone's waiting for a vaccine. You're really treating symptoms and trying to help people recover from the disease, not cure the disease. We have the best protocols that we're following here. Those are shared nationally. I just checked, we have enough remdesivir to treat 36 unique patients right now. Every week we get more, and they're working nationally to produce much more. But we've cared for about 200 COVID-19 patients so far since about April 1. It's not a huge number if you look at it. Many more patients have been ruled out. We call those patients under investigation, PUIs. But it's been about 200 people that have been hospitalized, but probably 5 times that have been cared for at home and didn't need to come to the hospital. That's about 20% that get hospitalized. So there's been 1,000 or so, Genesis COVID patients that have been positive. Let's see, what else could I talk about? Maybe a little bit about testing. Testing's really interesting. If you think about it this way, we've done nationally a pretty incredible job with testing. We test almost 1,000 patients a day nationally, and to go from 8 months ago where there was no testing capability, or 7 really, because we're just barely into August, no testing capability at all for this disease in December, to being able to do 1 million tests a day within the country. Pretty incredible. Not good enough, but pretty incredible. At Genesis, there's 3 sources of testing and collection. The first is our own internal. I'll talk about that a little bit more. The second is our lab partner, who is LabCorp. And LabCorp has a number of national sites. We happen to send our tests to Kansas City, Missouri, and they have pretty good turnaround right now, but they have been challenged with turnaround as these tests have ramped up from 0 to 1 million. Obviously that's a lot of tests. And then lastly is the state lab, and the state lab processes tests like the Test Iowa and that testing, etc. Not many health systems have their own equipment. We have 3 machines. The reason we have those machines is because we established a LabCorp partnership several years ago. They are the ones that got us the machines. If you look around, there's no local testing for Unity Point. They send all theirs to a central testing site that they have within Des Moines. No local testing for places like Great River or Clinton. And so this is pretty unique to be able to have local testing. So our 3 machines mean that we could test up to locally 250 to 300 patients per day. We had 1 machine initially. I was very concerned that we wouldn't have the backup that we needed, and so we worked very hard to get a second and a 3rd machine. It's just not like you can go out and buy these. The distribution of these is completely controlled by the federal government and by organizations like LabCorp and Quest Labs, which are big national labs. So what about our remaining challenges? Well, we need people to follow the guidelines. This is not going to be over until there's a vaccine. And if you pin me down, I would say, probably the vaccines will be released, if everything goes on schedule the way it looks right now, around the first of the year, and it'll take 3 or 4 months to get that vaccine distributed. And so we're going to find ourselves maybe in a different situation in April or May of next year. But until then, we're just going to have to learn how to coexist with COVID-19. We certainly can do that as a hospital system. We're running full operation right now, and yet every day we take care of 20 to 25 COVID-19 patients. So it's not disrupting us at all. We can keep everybody safe and still take care of everything we need to do. Again, I talked about the ICU. The ICU is the area of greatest concern for us right now. We also watch things very carefully in the region. There was an unusual situation about 2 weeks ago where there was a group of 400 migrant workers that came into a community south of Muscatine to do some harvesting of plant or of vegetables and such, and they were not using any protective equipment, and they had a lot of positive tests. And you think about that, you say 400 people, and how many of them are positive, and then how many need to be hospitalized, and how many in the ICU. It can get really ugly really quickly. So we handled that very carefully. But the first 10 in that situation go to the university. The second 10 go to us in anything within about 150-mile radius. So that could kind of throw things off as well. Nationally, 43% of the people that have died from COVID-19 have died in nursing homes. And so the nursing homes are of great concern. And so we watch the nursing homes very carefully. And we have helped the nursing homes dramatically within our region to make sure that they have enough PPE and they have a good plan to take care of people in place. They don't need to, only the worst would have to come to Genesis. I did want to talk a little bit about financially how this has impacted us, because it's frankly, it's been devastating to United States healthcare. They estimate around $300 billion in cost in lost revenue. That is a huge number, you know, $1/3 of $1 trillion in lost revenue. And why did that happen? Well, because in March and in April and most of May, we were asked to suspend half of our operation. And so for us, during that time frame, we lost out on $36 million worth of revenue. Well, we lost out on more than that, but that's what it cost us on the bottom line, $36 million negative. Now, the federal government came in with monies very early on, nothing since then, nothing since May, called the CARES Act, and they provided about $50 to $60 billion to hospitals within the country, and 18 million came to us. So it cost us 36 million so far. 18 million of that offset from a special grant that came from the federal government. So our negative right now is 18 million. And that's about the same for most organizations on a percentage basis within that I've compared to within kind of this region. Some organizations hit harder nationally than others. Some people have speculated, hey, we hear you do really well on COVID-19 patients. That's not true. We don't get paid that much. We get paid on a per case basis. When somebody stays a month, you know, we probably started to lose money after the 7th day. So financially, we can talk more about how challenging it's been, but that's a lot of money. You know, we're approaching $20 million negative. So we'll have our worst year ever financially. Genesis will, when we close up the books in fiscal year 20. I did want to talk a little bit about the future, and I'm going to shift gears here, and then we'll open it up for questions, whatever anybody wants to ask. The biggest thing that's happened that's probably changing healthcare as a result of COVID-19 is what I would call virtual care, and that is using exactly what we're using, you know, to talk to each other. So the advent or the higher utilization of telemedicine. We went from having very few telemedicine visits per day to having 10% of all of our visits with physicians be telemedicine. There's a model for provider to patient, which is let's say it's your primary care physician or your OB or a specialist that's connecting with you. There'll also be a provider to provider piece. What about a emergency room physician needs a consult with an orthopedist? They may do that over virtual care rather than having that person drive in. That's all expanding dramatically, and we're making major investments in this area. Another interesting thing that I think is very convenient, some people have always been big fans of the Mayo Clinic. Why do they like the Mayo Clinic? Well, they can go to one place and they can see multiple providers on the same day and get diagnosed on the same day. Why can't that happen virtually? Let's say you go to a primary care physician's office, let's say it's Dr. Crome, and he needs to consult with a cardiologist. And so he links in CVM right then, right during your appointment. And also needs to see you need to see a pulmonologist, and he links in Dr. Wong from pulmonary care. So we have a vision that we can change and make much more convenient, much more collaborative the way somebody receives care in virtual care. What can be done telephonically or in telemedicine over internet connection happens that way, and then the other things can happen in person that need to happen in person. There's a lot of barriers to this. There's insurance barriers, there's regulatory barriers, there's reimbursement barriers. But for organizations that are very mature in this area, and Kaiser, if you know them, is the most mature, and they're mostly in California. They have insurance physicians and hospitals all under one umbrella. They see 50% of their visits this way, and they're very developed in the whole area of what I would call virtual care. The other thing that's happening that we're working very hard on is strengthening what we call our service lines, and these are clinical areas across the whole organization. For instance, cancer treatment or cancer diagnostics and intervention. Anything to do with cardiovascular, thoracic, and or vascular is another area we're strengthening. Gastrointestinal services, neurosciences services. So we're spending a lot of time, surgical services would be another one. We're spending a lot of time organizing ourselves differently, engaging physicians differently to strengthen our clinical care delivery and integrate it much more across the whole continuum, from the physician part to the home part to the surgical part, as an example. Another area that's the future within our region is an organization that we founded, a joint venture between us and Wesley Life called WellSpire. And WellSpire has one campus, senior community under construction called The Summit. It's at the roundabout. If you drive out in that area, you'll see it. It's a collection of senior housing, assisted living, and nursing home under one campus construction with a common area. Very innovative, nothing like it exists in the Quad Cities. And that'll be done about a year from now. And we're very, very excited about what we're going to be able to offer with Wesley Life under this WellSpire umbrella. The next development was just approved last Thursday by the board, and it is called Fieldstone, and it will be in DeWitt across from the hospital, and it'll have the same services. Some limited senior housing, most of that's in a phase 2, but senior housing, assisted living, and then the replacement of the nursing home, which up there is called West Wing. This will be a tremendous benefit for that DeWitt region and that DeWitt community. So we are super excited, and we envision 5 or 6 of these within the region over the next 5 to 7 years, as we work to, in that partnership, work to provide much better and much more cutting edge and resident friendly senior services to our community. Lastly, before I open it up for questions, I want to just talk about a super exciting thing that you may have just started to see advertised. And this is an award that we won, and I happen to be holding it right here. It recognizes us as a top 15 health system. So there's about 350 health systems in the country, and we were recognized as in the top 15, which is the top 5%. And these are very meaningful indicators. So they have 10 metrics that they use to judge who's the best in the country. And when they did the math, we came out at the 2.7th percentile. So that means we're in the top 3% of all health systems in the country, which is pretty incredible. And that was just recognition that we were just given and just became public in July. And so we're very pleased with that. It recognizes us mostly for quality healthcare across every aspect of Genesis, not just hospital piece, but other pieces. So with that, that's a lot of info. I talked fast, and we are at 1:24. I've been talking for 24 minutes. Let's take some questions. Missy, you are still on mute.
I thought I was, am I unmuted?
Now you are unmuted. Yeah.
Thank you. We're going to encourage everyone to use the chat feature. And while you're thinking up any questions you may have for Doug, I know that it takes, to get to the top 15 hospital in the United States, it takes a great workforce. And one of the things that I wanted you to address is the I guess, pressures or how the workforce is handling COVID and some of the additional stressors that have been in place this year, especially when you talk about this happening, probably coexisting until the spring. That means it's a one year out of our lives as a health workforce. Can you address how they're doing?
Well, I would say that in total, the workforce has done very well. You know, if you think about it, every single employee at Genesis was impacted somehow. I mean, we furloughed 1,000 employees in the month of April. 1,000 people. That's 1/5 of our workforce. We're not working at all. Now, we provided them with support and those that had financial challenges, but of all the people that have been impacted, I think the people that have been impacted the most are the frontline workers that work with COVID-19 patients or potential COVID-19 patients. So those are people on our nursing units that are dedicated to COVID, our ICUs, our urgent cares, our physician clinics, our emergency departments. This is difficult. And I think psychologically it was much more difficult probably early on than it is now. I think for the most part they've adjusted. They figured out how to do this. When I talk with them, and I round at least a couple times a week in these areas and talk with the people that are actually delivering the care to these COVID patients, they're doing pretty well. But it was scary at first. It's interesting that, you know, we deal with lots of bad stuff, particularly in our hospitals. You know, MRSA, we were prepared for Ebola, it didn't arrive, but we deal with bad infections every day. We have something called universal precautions. But something about this was different and scary because it hadn't happened before. But what's interesting is that of all the people we've cared for and the thousands and thousands of thousands interactions we've had with these 200 patients, some of whom, again, stayed for more than a month, we've only had 2 employees out of our 6,000 that we believe may have acquired this at work. And so we've been able to provide everybody with the equipment needed to protect them. But it takes the psychological toll. I would say it was palpably challenging in April when I rounded and I went to some staff meetings. I mean, it was tough psychologically, but it's a different place, but it's also a bit of a marathon, right? It's not a sprint. Like I said, it's a bit of a marathon, and we have to support them and help them all the way along. So those are the areas where it's the toughest. I just spent some time recognizing there's an email that goes out right now a couple times a week. It used to go out daily. It's a message from me, and I work very hard on what I'm going to say and crafting that. Yesterday, I recognized particularly the nurses, and I did that through some cards that some 8- and 9-year-old kids sent me. And, you know, they were really touching. And, you know, it's the nurse, what can I say? The nurses are special, and, you know, they put their lives on the line every day to care for people in so many different ways, but it does take its toll. Thanks, Missy. That's a good question. What else?
I have a question about turnaround time on the testing. What's been your experience? How long does it take for a person who's tested to find out the result?
It depends on the day. It depends on the day. So right now, our turnaround time is less than a day.
Oh, that's great.
But if you go back to April, it was as long as 10 days when we didn't have any internal testing capability, and when LabCorp was simply swamped, it was 10 days. Now, if your turnaround time is 10 days and you've got patients under investigation, the whole time while you wait for that test, you have to treat those people as if they're positive. That causes a real challenge. And so that's why we saw a lot of challenge in what was happening. And this is one reason why we worked so hard to get internal testing. Because if I can do internal testing and I can know in 5 hours or 6 hours whether that patient's really got COVID-19 or not, then it helps us get the right people in the right place at the right time and rule out whether it's a positive or not. So right now it's less than a day, but it has varied dramatically. And if that test needs to be sent out to LabCorp, right now it's 2 days. But when we had growing pains and we're growing from 500,000 tests a day to 1 million tests a day, you know, in many cases we were overwhelming the regional facilities until they could bring another regional facility online. Our testing that gets sent out to LabCorp has moved 3 times in the last 3 months as they brought on additional sites.
Doug, I know early on we were part of a study with Mayo for convalescent plasma.
Yes.
I was reading that there is another hospital, I think it might be Cedar Rapids, that's doing a study with the antibodies, using that as a therapy. Do you envision us getting involved in anything like that, or any early trials on vaccines, for example? Anything where we would be a front runner in our community?
I don't think that we're going to be involved in the vaccine piece. I know the university is on a limited basis, but you know, we try to be an early adopter of any kind of treatment. I don't think we're doing anything with antibodies, but we did do that with convalescent plasma. We had a number of patients, and we think they did better because of that. So all the people that are the core group that's really involved in taking care of COVID-19 patients is frequently, every day, looking at national protocols, making sure we're providing the best care possible. And that's why I say remdesivir seems to be the best possible right now. But there are these other aspects, you know, that are being looked at nationally. But there's really the science and the collaboration is unique around this. It's really one time. I've never seen this much collaboration. You know, there's about 100+ vaccines that are out there somewhere in the process. You've never seen anything like the worldwide collaboration to develop the vaccine that we're seeing right now. It normally takes, we did a lot of research around this, so the process we know normally takes 15 years. We'll do in 1 year what normally takes 15 years to produce and develop a vaccine with millions of doses. What else? Anybody?
Doug, this has a lot of people wondering about the efficacy of the vaccine or the safety around having a vaccine come out so quickly. Any concerns?
I was on a phone call with Dr. Fauci 3 weeks ago, and this is in my role on the AHA board. There's 20 of us on the AHA board, and it's an appointment for 3 years. And so you actually get elected. And I come off at the end of this year, but that's been a lot of fun. And we asked Dr. Fauci that question because you say, well, if you're cramming into 1 year what you normally do in 15, is it going to be safe? And he's as close to this as anybody. And there's been controversy around him, but I am a huge fan of him. I think he has done a fantastic job. He tells the truth. He's very articulate. He has so much knowledge because he's been there forever, literally. And he told us that when the vaccine comes out in the United States, it will have gone through all the normal testing of any vaccine, and it will be safe. Now, you may have noticed they announced something yesterday in Russia. Who knows exactly what that is? They call the new vaccine Sputnik because it's a little bit like the space race, right? So I'm concerned about the Russian vaccine, but I will not have concerns about the US vaccine. We asked Dr. Fauci who's going to go first. Healthcare workers will go first. My guess is, we'll make sure it's our frontline people, but maybe I'll be in healthcare round 2. I have no hesitation about taking the vaccine myself. So.
It's good to know.
When we get to herd immunity is when things really start to help us. When we get to 60 to 70% of the people being vaccinated, that's when we'll be in better shape. Now, some of us on the call are a little bit older. I'm a little bit older. How many of you remember the polio vaccine in the 60s? Yeah. I remember when the polio vaccine came out, I took it on a sugar cube. I was in the longest line I've ever seen. I think I was either 4 or 5 years old. And it's a similar thing. The polio vaccine comes out. Everybody's going to get vaccinated for polio. And gratefully, I was in that generation that was able to take the vaccine because I know
that was in the 50s for us, Doug.
Okay, well, I can tell you it was in the early 60s for me because I was born in 59. But I have friends that I know a little bit older that had polio, and it was a horrible thing, right? So, but that's kind of the spiel about the vaccine.
Doug, a lot of people were fearful about using Genesis services for the period of time that we were just starting to ramp back up, and even to use emergency services when we weren't doing electives. Has most of our business bounced back? Do you have any concerns about people who are still holding off on emergent care or screenings and so forth?
I think most of our businesses bounce back with one exception, and that's less about fear and more about a change in practice. And that is our convenient care. Our urgent care has not bounced back. It's running about 75% of normal volume. Almost every other area has bounced back completely, with very few exceptions. I think it's interesting to note, and it'll be interesting to watch where urgent care goes. We have a pretty big operation in convenient care. We have multiple sites. I think we have about 8 total sites around the Quad Cities. I know this is the same for other health systems, and I know it's the same for Unity Point, but that's the one piece that hasn't bounced back. I would say that in the month of May, as we started to ramp up, and then a month of June, there were a lot of concerns about that. We know of no patient that's acquired COVID-19 in the hospital. I know everybody's concerned about that, but we're very used to caring for people with very bad things and very bad infections, and that's where personal protective equipment comes in. So it's very safe to come in here. It's much safer than probably at home, frankly.
Doug, you're talking with a lot of people that have made a charitable investment in Genesis, and we know that you're doing a great job, and we're still a very strong healthcare system. But there are opportunities for philanthropy to do some of the things that are on your wish list, or some of the things that you would consider part of the vision for Genesis Health System. When you talk about technological changes and telehealth, where might a charitable dollar make a difference so that we can use capital for other purposes?
You know, we're defining what those investments will be, but it will require both capital as well as software. Anything that we can, and my guess is it'll be millions of dollars that we'll have to invest. Anything that we can use charitable contributions for helps us free up other dollars, which are very scarce for us to be able to invest in the latest and greatest technology to keep us technology current. So anytime we put a list together for any year, there's always twice as much need as there is capital money. And so we're always pushing out investments to be able to, unfortunately, afford what we need to do in that given year, whether it's replace a linear accelerator so we can do the latest and greatest cancer care. So cash is short, even though we're in a really good financial position. Cash is short and scarce. And so if we could get donations, for instance, for virtual care, then we can use those donations for that, and it frees up the money that we can fund ourselves to go to things like replacement of ORs, which we're gonna do this year within Silvus, as we invest about $20 million in Silvus's master plan over the next 2.5 years, and or things like I said, like a linear accelerator or other technology. So that's what happens. You're helping us do more than we could normally do to help us keep current. And I would say, to go back to your comment, Missy, you know, the community should be extremely proud. This is your health system. This is not my health system. This is your health system, although it cared for me and my family. And your health system was just ranked in the top 15, the top 3% of all health systems in the country, you know, in the whole country. It's never happened. Nobody in Iowa has ever had this recognition. It's happened once in Illinois. That's Advocate and Aurora was recognized. These are Mayo Clinic type standards, Cleveland Clinic, Mayo Clinic. We're among the best in the country, top 3%. So it's an incredible accomplishment. However, the only way we can stay there is with philanthropy, frankly. We can't stay there without the help of the community and those of you who give to Genesis, because otherwise we can't afford it all. We can't afford it all.
And it's not just capital expenditure. I know that you and I have talked before about how the workforce has to continue to adapt as well. And being able to, for example, pull a nurse off one unit and get that nurse up to speed to go into an ICU situation, for example. Do you will have additional training expense?
Exactly. And I would say, like I said earlier, thank you, Missy, that our ICU is one of our most challenging areas. And so what has Foundation Dollars helped us do? They've helped us take people who want to be nurses and couldn't otherwise afford to be nurses and move from a CNA to nursing school. And then those who are in nursing school, help move them from nurses to advanced nurses. And all of that increases or improves the level of care and the quality of care within Genesis. And so you just gave a fantastic example of another area where philanthropy makes all the difference. And I don't know how many millions, since I've been here the last 12 years, how many millions have been given to improve and fund nursing education within Genesis, right? It's millions and millions. And this is huge for us. You could ask Dr. Bull, what's other than having quality physicians, what's the biggest thing that lends to quality within a healthcare system? And it would be quality nursing.
We've got about 4 minutes, Doug. If there was anything else that you felt was top of mind that you wanted to share, I also want to entertain any other questions.
Does anybody have any other questions anybody would like to ask?
Doug's time is pretty sparse. I know that we have you running from one meeting to another and try to eke out as much of your time as we possibly can.
Well, I would just close by thanking you for being involved in Genesis, thanking you for giving to Genesis, for helping us to stay at the cutting edge of providing the best quality that we can. And again, we're very pleased to be able to be recognized as one of the top 15 health systems in the country out of 350 health systems. And we would ask you to help us stay there. This is a recognition that we'd like to achieve for the community every year going forward. And there's no reason why we can't stay there, but we're going to need some help, because without philanthropy, we simply can't do that. That gives us the edge to perform at that level. One of the challenges we have, and I talked about our financial performance, but one of the things you may not know is that in Iowa and Illinois, we get paid worse almost than any other state in the country for what we do. Payment varies across the country. So for Medicaid, Medicare, and commercial insurance, we get paid very poorly, which means after we pay our expenses, because we get paid so poorly, we have to have a really low cost structure, and we have very little left over. Other parts of the country can fund all these needs. We have to have philanthropy to be able to fund it.
So if anyone knows of someone else who shares their value for healthcare and the investment that they've made and wants to see us grow and thrive as an organization, we would certainly welcome the opportunity to talk to those individuals. Well, Doug, we want to thank you for your time today, and I certainly want to thank our Circle of Care members. If you could just give us a thumbs up or some type of feedback if this is the type of exchange that you'd like to see in the future. I know we're going to be probably in this situation for a while before we can bring people back together. We want to be safe. I see Margaret's got her thumb up, so that's good. We want to bring this type of information from Doug to you. We've also talked about having physicians, for example. So as people are interested in how COVID is affecting patients who potentially have a heart condition, maybe speak to a cardiologist. We want to bring in some of our other resource experts. So I would love that feedback. Just let us know who you would like to hear from. And certainly we would want Doug to continue to be part of those conversations as well. So we welcome your ideas. We welcome your charitable investment. We welcome introductions to other individuals just like you who have made Genesis the great organization that it is. Doug, one final question. How are you doing personally, and what can we do to support you?
Well, thank you. I worked very hard to stay balanced in my life, and I'm doing just fine. I would say that it was pretty stressful in March, but it's been much better since then. But those 2 weeks in March will go down as some of the more stressful in my life of my 39-year career. So I'd like to not repeat that again, but right now I'm doing great. So
Okay, good.
I'd just like to get power back on at my house. That would be nice.
Somebody zip out to Doug's house and help with the power. All right, that's all the time we have for today. Thanks, everybody. Take care. Stay safe.
Take care.
Thank you.